Now, this morning, we are focusing on your eyes. Data from the World Health Organization estimates about 20% of cataracts worldwide may be caused by overexposure to UV radiation. Jacksonville optometric physician Dr. Kimberly Riordan with Florida Eye Specialist is joining us this morning. Good morning. Thanks for being here. We appreciate you. All right. You know, we remind people all the time about the importance of wearing sunglasses. They're not just for the look. They are important to protecting your eyes. Can you explain a little bit about the impact that UV has on our eyes?
Yes, research has shown that overexposure to UVA and UVB radiation can increase risk of certain conditions such as macular degeneration. Also, our eyelid skin is very thin, so it's susceptible to skin cancer, so it's important to protect our eyes that way as well. But also, overexposure to UV radiation can increase your risk of developing cataracts.
And is that exposure, you know, you're never supposed to look directly into the sun. I mean, is it more apparent that way, or is it just being outside and you're by the pool or by the water and that kind of reflects up into your eyes?
Absolutely. So yeah, and not just on those sunny days either. You know, we're talking about it because it's summer months, but all year round we're at risk of it. So, and especially out on the water, the sunlight reflecting off the water also is a risk too.
And so as much as a hat is great, you need to have something that protects your eyes, and really sunglasses are a great way to do that, correct?
Absolutely.
Do you have to get the expensive, you know, kind of, always whenever I'm looking, I'm like, okay, these are like $200, but these look like they might be the same and are at a fraction of the price.
It's what you really is important is making sure that they have UVA and UVB protection. And most of them will be labeled with that.
Yeah, so it's interesting.
What you want to spend is up to you.
Okay, right, okay. What's interesting is a lot of times, because they'll have that little kind of round kind of circle on it, it says UV protection. Yes. Do you specifically need to look for UVA and UVB indicated on that label, or does it matter?
Thankfully in the U.S., most of them are going to have UVA and UVB protection.
Okay.
So I would just be cautionary to what you buy online if you don't know where they're coming from. But if you're buying them from U.S. retailers, they're going to have UVA and UVB protection.
Okay, excellent. We hopefully just saved you a couple $100 on that one. All right, let's talk a little bit about cataracts. What are some of the warning signs of cataracts?
So with cataracts, they're kind of sneaky. First of all, we all get them. They're like gray hairs and wrinkles. We're not getting away from it. So it's not when you develop, or if you develop them, it's when. But subtle signs, subtle changes to our vision over time, things not seeming as clear. They can seem blurry, hazy, double vision, glare, sensitivity to light. I'd say a big one or two would be changes to your color perception and also difficulty seeing at night. So a lot of people actually stop driving at night because they just don't feel comfortable. Yeah,
no, it's funny. My mother is that way because she just doesn't kind of trust herself so much, and she is in her mid-70s. What are some treatments and the latest treatments on this? Because some people can get a little intimidated by that.
Yes, well, it's intimidating to hear that you've been diagnosed with cataracts. It's actually a good diagnosis to have because we can cure cataracts with cataract surgery. Cataract surgery is one of the most commonly performed procedures and safest procedures in all of medicine. And what's really exciting is there are so many lens options, because what a cataract is the clouding of our natural lens. We remove that lens, we have to replace it with something, and we have amazing options. And we're lucky in Northeast Florida, we have Florida Eye Specialists, we have the highly skilled ophthalmologists that are on top of all the latest and greatest in technology. So most of our patients come out seeing better than they've ever seen.
Yeah, which is fantastic. There are some people who may say that they kind of see things when they're looking, they kind of like maybe see fibers or little spots. Is that cataract related, or could that be something else?
That's something different. So when we see those little spots and specks that kind of float in and out of our vision, those are what we call floaters. So that's actually in the jelly part of the eye, or the vitreous. Two separate things.
Do you have to worry about that? Does it just kind of go away on its own? Should you consult a doctor?
If they're new to you, you should absolutely call and seek immediate attention, because new floaters can indicate problems with your retina or a retinal tear. So never ignore any new floaters, but floaters can be common. So if they're always been there, nothing to be concerned about. However, if they're new or accompanied with flashes of light, definitely call.
Not necessarily a sun-related question, but, you know, as people get older and it gets, you know, you're starting to read a little bit from here, do you have any guidance or advice when it comes to people just go to the, you know, CVS or Walgreens, grab some peepers and say, okay, that's fine? Is that a good, bad idea? Should you talk to a doctor first who can take a good look to decide whether or not you need a prescription?
I would say if you have not had an eye exam recently, get your eyes examined first, because yes, over-the-counter readers can work and they're great. However, it's good to rule out there's nothing else causing you to not be able to read.
Great information. Thank you so much. Don't spend a lot of money on those sunglasses for sure, but make sure that you wear them. Have a wonderful day. We appreciate you.
You too.
All right, and you're going to need those sunglasses actually today because we have got quite a bit of sun out there and some rain moving into the forecast later this week. Katie's here now with a closer look.